CHEK Podcasts.
Welcome to Political Capital, your source for all the latest in BC politics. I'm your host, Rob Shaw, coming to you as always from the CHEK News World Headquarters / Emergency Broadcast Reception Center here in Victoria. A weird week in BC politics. We have the Premier Designate, David Eby, continuing his slow motion transition to power, while at the same time the business of government is lurching on with updates on doctors' pay and the overdose crisis. To break all this down, let us bring in the pod squad. Katie is off this week, but I'm thrilled to welcome back friend of the show, Allie Blades is here. She's a campaign strategist with MASH Strategy, who has been a senior member of 2 BC Liberal leadership campaigns and most recently the BC deputy for the Pierre Poilievre campaign. Allie, thank you for coming back.
Thanks for having me back.
And she is joined by our favorites, Jeff and Jillian, here, as always, each and every week. Hello to you, too. We are going to jump right into business, though. This week in BC politics started with a tentative deal with BC doctors designed to address the family doctors quitting because they're paid too little under this complicated existing fee-for-service model. Now, the new pay system is going to better recognize the complexity of patients and number of patients, and it will also include a government-run wait list called a patient registry by mid-next year. So let's start there. The family doctor shortage, a crisis. Governments have wrestled with it for many years. This takes a stab at solving it. Is it enough? Will it do anything? Does it lower the political pressure? Allie, let's start with you on that.
Sure. So is it enough? Absolutely not, but it will never be enough. What we've done here is help mitigate a couple of issues of attracting more doctors to our province with promise of more money and creating more medical student seats, but which all sounds great, right? But healthcare is a team approach and will support for nurses and first responders also endure just as much frustration, headache, and time. So the issue here isn't the intent. Solving the complex issues is not done overnight. But the criticism is lack of immediate helpful action. So to the second point, does it lower the political pressure? Well, the opposition have been asking for action on this for the better part of a year. Unfortunately, when basic level healthcare impacts every family in BC, people are paying close attention. So no government is really ever off the hook.
Mm-hmm. The people just want to see this boiled down to the basic issue of, can I get a family doctor? I don't, who knows how doctors are paid? Can I get one? I think you're right, and that political pressure will still be there. Jillian, what did you make of this?
I think it definitely shows that the government is feeling the heat on this. It's a pretty sizable investment and a pretty big shift in how doctors are getting paid. Instead of getting paid per visit, they're now getting paid for their time based on a whole bunch of other kind of measurables. And I think this is, it's a really important first step in improving not just access to primary care by hopefully attracting and retaining more doctors, but by also making sure that primary care is shifting to a more preventative model so that the other parts of our healthcare system aren't having to deal with issues once they're in the point of crisis. In terms of the political heat, I mean, primary care and family doctors is just one piece of the puzzle. All week in question period, we saw the opposition talk about cancer wait times, emergency care, issues with pediatric care. So still, a lot of heat on the government on those issues, which are, those are more urgent emergency issues that I think we'll continue to hear about probably on a weekly basis. But I think that this does give the government something to point to when it comes to primary care, that they're listening, they understand how severe the problem is, and they're taking significant action in the form of a fairly major investment to address it.
Mm-hmm. And it removes a critic off the board, too, because now when the opposition brings up the family doctor crisis, Doctors of BC is already behind this deal. So it's hard for, people who, like myself, covering it to find a doctor who is upset with the pay model when the government has basically given them the pay model that they wanted. But Jeff, the pay model will increase the average pay for a family doctor from, I think, around $250,000 a year to more than $380,000, depending on who they see. It's going to cost government $700 million, which is a lot. But does Does anybody care about that, or do they just care about boiling it down to give me a doctor and government, you do whatever you need to do?
I think you've heard me say on this fine show before that on this issue, people want the issue solved more than they care about what the bottom line implications are for Treasury Board and Finance. So I think that, and that's because, there's one issue on healthcare that's going to get a government defeated, and that's, can I see a doctor when I need to see a doctor? And this responds to that. And I think people will be happy to see this. I heard the doctors today describe the deal as a ray of sunshine for family doctors, as a seismic shift for the better in the way doctors are compensated and how they'll work. I think it's strong medicine for British Columbians suffering from family doctor withdrawal. But I also think it's important for government to stay humble on this, because as Jillian and Allie have pointed out, this is only part of a multifaceted treatment plan for the issue, and it's going to take a lot more. Government is doing a whole bunch of good things in terms of paying residents more. They are expanding scope of practice so nurse practitioners and pharmacists can take some pressure off of family doctors. And but for most family doctors who I talked with and dealt with when I was in the Ministry of Finance, the most important thing here is now family doctors are going to be able to practice family medicine the way they were taught to and they want to, which is focused on patients, making sure that they are with a long-term view of their health, and not this fee-for-service, see as many people as quickly as you can to make as much money as you can model. And it's going to make sure folks can continue to practice. So I'm not as cynical as others.
What?
I think this is good, and I'm talking too much, so I'm going to shut up.
Turn your cynicism level up, Jeff. I'll do it for you. I'll jump in. That's kind of what I do here. But I think there's a kind of an almost deadline that government built into this announcement, because it said that it was creating this government waitlist patient registry thing that will launch mid-next year to the end of next year, where its billed as matching you up with a family doctor. And I think for a lot of people, the million or so people without a family doctor right now, stuck waiting outside an urgent primary care center before it even opens to see if they can get in, they're going to want to see something out of that registry, and not a flashy ribbon-cutting announcement, an actual thing. And I wonder if government has locked itself in here to a bit of a premature result when, in fact, changing the pay model is going to require new family doctors going through school and coming out, making decisions and that type of thing. So I don't know, Allie. I'll give you a bonus question here as the guest. Does that timeline kind of, do you think that troubles government? I mean, obviously not. They said it, but does it create a kind of situation where it has to show some results perhaps earlier than it ever can?
Oh, it absolutely is going to cause some issues. But the other key aspect in there is that health is a very unique approach. So some people are going to be advocating for their health a little bit stronger than others, depending on what their needs are. And so if you constrict it a little bit too much, is it really helping the patient? We'll see.
Yeah, we will. I mean, it's the rubber meets the road moment for a lot of people next year when they can sign up on this list and then they want to see something happen with their name on that list. So let's move on to another healthcare issue, which is the all-party legislative committee that was studying the overdose crisis, spent 7 months on that issue and released its report this week. I described it as a report full of recommendations that we already knew were needed, given to a mental health and addictions minister who says she's already doing them. So, yeah, but MLAs say getting that the Liberals, the Greens, and the NDP together to point out that the NDP government must urgently and drastically increase its treatment options and its safe supply and its safe consumption options. It helps because it puts everyone on the same page. So that's where we're at. Jillian, the government has spent a lot of money on this. So what do you think?
I think that it was really critical in getting, all three parties in the House on the same side, and also of sort of digging down into, the situation that you described, where we have so many reports, all of these recommendations. Government says it's already doing those, but every month we get a report from the coroner that shows that these deaths are still happening. I think that so it really digs into the implementation issues and gets everybody on the same page. And I think that's really important. The report talked about, safe injection sites. We've had them in BC for a long time, but the report talked about how there's still barriers in some communities because of polarized views. So having MLAs from all parties, from all parts of the province to really understand that, to get consensus on that issue, then those MLAs can become advocates in their communities for that and hopefully break down some of those barriers to implementation in parts of the province where we're still not seeing those services delivered. Same thing on safe supply that we got, all MLAs heard from police chiefs, addiction experts, that there are still barriers, even though we have safe supply, the government says that it's being implemented, that there's barriers because of stigma. That helps, MLAs again become advocates for that issue and to help sort of work with their communities to make sure that it's actually getting to the people that need it in the form that it is needed. And the report goes into details about how they can do that. So I think it's valuable on that front. And then, with stigma overall, these, again, we've heard that again and again, but it takes a really long time for these societal shifts to happen. And the report did underscore how, polarization on this issue and, the potential for politicization is a barrier, both, to implementing, more progressive policies, but also to sort of, actually carrying out the ones that are already in place. So I think that this moves the needle a little bit on that. And hopefully, we'll be able to see more urgent government action and government acting a little bit more boldly without sort of political reservations for some of the more controversial measures that are needed.
Especially in the north and in rural and remote communities and indigenous communities. I noted that the highest rate of deaths are in Northern Health, and 20 years after we have our first supervised consumption site in Vancouver, we're just now getting to the point where Northern Health says it has harm reduction, some type of harm reduction in every community up there, which is 2 decades later. But nonetheless, you're right. There are parts of the province where hopefully MLAs will be able to advocate for this. Jeff, the government spent $2 billion on this, it said, and it listed a long, long list of announcements it's made in the last 4 months alone. There's a new sobering center in Prince George, Foundry locations, more beds. And I think the problem, though, we've talked about before, is they're not coalescing into an actual system here. And the report points that out. You've still got the silos and gaps, wait times, no oversight, no metrics, no goals, people bouncing off the system. 72% of those people who died from toxic drugs had an interaction with a healthcare provider recently, and they weren't kind of brought in. So, I mean, how do we change all of that, Jeff? Just summarize it for us in a couple of minutes, how we fix the entire problem.
Well, I think the problem is past and present. I think we're way ahead of many other provinces, but we're still not as integrated as we should be on mental health and addiction because governments and society writ large have approached these issues with moral judgments and not seen it as a priority until I think the most recent 2 governments. I think some of it is structural today. I think Sheila Malcolmson is a very fine person and a very committed minister. And I think the creation of the Ministry of Mental Health and Addictions was well-intentioned. But as the report makes clear, making progress is going to require more than action just on mental health. It requires broad and systemic action across a whole range of ministries. And a lot of these lie outside the statutory decision-making power of Minister Malcolmson's ministry. So maybe that needs to change, and maybe that can change during transition as Premier Designate Eby considers the step forwards. And I do want to emphasize something that Jillian said. It's quite an odd couple situation here, where you have the government playing Felix Unger and the opposition parties playing Oscar Madison, always at odds, completely different, but they figure it out. They've come to a consensus on what the problems are and what the solutions are. And I think it's remarkable that we have all the parties in agreement that the solution must include decriminalization of drug use, that it must include safe supply of drugs to prevent toxic drug poisonings. That dog agrees. That it must include universal access to publicly funded mental health services and supports in addiction treatment. It must include taking on the colleges that have been barriers to this stuff getting out there, and doing it in every part of the province. And so you don't hear, hey, if you're going to do this, you're going to make our kids heroin addicts. We're not going to hear spending on this is too expensive. We're not going to hear, yeah, this is fine for the cities, but keep it out of my backyard. And I think that's amazing. And I agree with Jillian. I look forward to all the MLAs and all the parties being advocates on these issues and pressing government to do more as it needs to do more.
Well, that's very impressive, Jeff. You summarized the issue. You got in a reference to The Odd Couple, and McDuff endorsed your plan in the background there. So that was that's pretty good.
I'm done for the show today.
That's right. Leave on a high note, as George Constanza would say. Allie, what about the politics of this? You know, this is an all-party committee, 3 parties that came together. Premier John Horgan was kind of reluctant to do that, but the hope was that the politics would be taken out of the overdose crisis if you brought everyone together and had them agree on what needs to be done. I guess the only issue is whether government actually does that or not. Do you think it changes the discussion about this in any better way?
No. So there obviously are some valuable benefits of having the all-party approach, mainly that your name's on it, folks. So you're accountable to every 75 pages of it. And when we're dealing with a crisis in this province, accountability is a good thing. But on the flip side, actually, there are a couple of those parties that aren't in government and not at the table when making decisions for how much money is going to be spent and what the rollout's going to be, and if they indeed prioritize it. I don't doubt that anyone will not prioritize it, but what's the continuation of this conversation? The final comment I'll make on this actually is my partisan soul also wonders what kinds of compromises were made so that it could get across the finish line, and if it would have resulted in a more bolder approach.
There was a reference from Sonia Furstenau, the Green leader, who said the recommendations are not as strong as she had wanted, I think. And although on the flip side of that, everyone seemed to praise Committee Chair Nikki Sharma, a New Democrat MLA who we're expecting to make cabinet, for managing to navigate a very difficult political situation to bring 3 parties with 3 different views, one party representing the government and loath to criticize itself, together in a report that criticizes government pretty hardly. So, I'm sure there were compromises made, but it's an interesting point for sure. Jeff, did you want to jump in? Do you have another dog bark there? Or?
Like I said, I'm done for the day. I've already achieved all that I'm going to do.
I don't think we've ever had a panelist just check out several minutes before the show ended before. I'm kidding. I think that Nikki Sharma did a really good job on this report. It's tough on government, and I think it's appropriately tough on government. That's the role of these committees. I think the value of the committees isn't, people say, oh, well, it's all the recommendations that we knew and it's articulating the problem that we knew. But innovation isn't what this committee is for. It's for social license, and it's for, coalescing and building coalitions. And I think it's really valuable. And yes, it is on the government to deliver. It makes the budgets. It puts people in cabinet. It does the mandate letters. But I know we'll be looking for, those of us on the NDP side will be looking for the BC Liberals and BC Greens to continue to show their support for the work that needs to get done. Okay.
And the commitments that were made in the plan.
Just moving on to the final issue here, which was John Horgan's last week in the legislature as premier, because the incoming administration of David Eby has cut a week from the legislative calendar. So when he is sworn in as premier on the 18th, the House doesn't come back until the 21st. Thought we'd share this great video from friends of the show Twitter account, No Context BC, which wraps up some of Horgan's funnier lines over the 5 years. We changed the soundtrack for copyright reasons, but here you go.
I'm looking for a sign. Are you the sign?
Premier John Horgan.
Thank you very much, Scott, and thanks everyone for being here this morning. There's been a lot of trains coming down my track over the past 5 years. The Twitter Dome and the Insta stuff, I very much regret that it landed with a thud. Come on, man.
I don't know if you want to zoom in on that. That's my telephone screen. Do some history, man. You do not need 48 eggs. I'm sure that all of us know to never read the comment section.
Now, when I say that, I can almost hear eyes glazing over.
It's a global pandemic, dude. The honorable member from way the heck over there. Come on, man. I play Scrabble. I have Spotify. I check my heart rate. I know what the weather's going to be like in Prince Rupert.
Anyone who wants to look at my telephone is happy to come to my office and look anytime they want to. Have gone up and gone down and gone up and gone down. No one came to me and said, holy cow. Oh, now I'm rambling. I'm chewing up the clock.
Oh, look at this. Intruder alert. Intruder alert. And I have email, I have text messages, and I have a telephone, and a host of other things that I don't even know what they are. Well, I don't know who you are.
Get a hobby. Find something else to do with your time.
On the faraway island of Salamasond, Yertle the turtle was king of the pond.
Why don't you go in the bathroom and talk to yourself in there? If you were woke, you'd know that pro rep is lit.
Any advice for whoever turns out to be your successor and to take the job?
Always duck early when you see the brick coming at you. The power of salmon is in all of us. So, we all good?
The power of salmon is in all of us. That's good. He's a funny premier. He had lots of great lines over 5 years. Even the ones that were gaffes, he turned them into strengths, and he'll be missed at the legislature for sure. Thank you for joining us this week on Political Capital. Thank you to Allie Blades for filling in, and thank you for watching. We'll be back next week for all the latest here on Political Capital.